After a 40-year-long wait for answers, victims of what's been described as the worst treatment scandal in NHS history have called on the former Prime Minister Sir John Major to give evidence to a special inquiry. Around 5,000 people across the UK were infected with HIV and Hepatitis C after they received contaminated blood. 3,000 are thought to have died. Our health correspondent Paul Kelso spoke to some of the survivors and victims' families and has this special report.
It is a scandal that has already claimed thousands of lives.
Our lives were shattered.
And many more will die before a public inquiry reaches its conclusion.
Every year there's less and less and less of you.
But after a 40-year wait for answers,
I'd like to think that they will find the truth.
the stories of the victims, living and dead, are finally being heard.
Yeah, that's the moment, and that was headmaster's office, staff rooms.
Ade, Steve and Gary have returned to the school that was supposed to transform their lives, but ended up threatening them.
Or going into hospital and being treated like something with rabies. Well,
that's not
Treloar College is a specialist school that in the 1970s and 80s welcomed haemophiliac boys.
through those green doors, and that's where the college ends and
The haemophilia
medical centre begins. Yeah.
It offered an education and revolutionary treatment. But in an NHS-run clinic, they were given contaminated blood products that gave them HIV and Hepatitis C. Of more than 80 boys, they are among just 16 who are still alive.
When I first arrived here, it was incredible. It was the most amazing place I'd ever seen. 35 acres of countryside, a great big mansion, Jacobean mansion, doctors, physios, nurses, treatment on demand. It was an amazing place for a 10-year-old boy to be.
It was a great time. You grew up with your friends from the age of 10 until 18. We played football, cricket.
100% attendance record, because if you had a bleed and had to be transfused with your injections, that would take between 15 minutes and half an hour, and you would literally go back to school. Just after breakfast, about 8:45, 8:30, something like that, we'd all prance down to the sick bay, stand outside the door, and then you'd go in and there'd be 3 or 4 tables ready with syringes on, full of Factor VIII. Bearing in mind we were children, 8, 9 years old, and we weren't really told a lot about it, really. They just said there's this new product on now and it's going to change your life. And yes, it did at that time, but obviously now we realise that it's killed a lot of us.
We were told that for some of us in that room had HIV. And they told us by going around the room saying, you have, you haven't, you have, you haven't, you have.
I was told that I had HIV in '83. Me and friend Steve just went in the room and matter-of-factly, you've been infected with HIV, we don't know anything about it, and we can't say for certain how long you're going to live for. Around 1983, 1984, when the link had been made between HIV, AIDS and haemophilia, overnight haemophilia became a dirty word. We were scared. We could see what was going on. We realised this link had been made and it could be us.
I'm the last remaining person alive in that room today.
It was difficult to come back to the reunions and things like that because you're not sure who's going to be there. It's destroyed everyone's lives.
The Infected Blood Inquiry is examining what happened to the Treloars boys and to nearly 5,000 other people infected in the UK. Nearly 3,000 of them have died, some of their names recorded in this memorial at the inquiry's headquarters. Contaminated Factor VIII, made from blood plasma, was imported in the 1970s and 80s, much of it from the United States, where it was collected from prisoners, sex workers and drug users who were paid for their blood. Professor Ted Tuddenham was a senior haematologist at the Royal Free Hospital in London. He says that Factor VIII promised to revolutionise the treatment of haemophilia.
Having a apparently clean, concentrated, stable, easily available, readily made up, easily infused product was an enormous advance, not just in convenience, but in efficacy.
He says he had no idea about contamination until it was too late.
The awareness that so many of our patients had been infected was devastating, more so for them than for us, but it certainly was devastating for us. The patients were beginning to die.
Lee was a very intelligent, bright little boy, and the brains of his mother. But yeah, he's a very clever lad.
Lee Turton was diagnosed with haemophilia at 6 months old. He contracted HIV from factor 8, aged 4. He died when he was 10.
When they called us in to speak to us, the consultant just said straight away, we've done a blood test, he's HIV positive, and we know as much as you know. But we'd already, months before that, been asking how safe the treatment was, because we'd heard that it was in the blood products.
I was to say, up to 4.5, he was fine, 5. But then, of course, the issues with the school, you know, and that would affect him. And then it started hurting him inside, that, you know, his friends didn't want to speak to him, didn't want to go near him. Teachers didn't want to teach him, and the press were pestering the house.
We had to move in the end, because we even walking, you know, if you went to the shops, there was people wouldn't go near you, and then there was a couple of people that said he'd be better off dead.
It seemed to come very quickly in the end, you know. All right, I'd say 18 months, 2 years, he started to fade on us. Somebody
had robbed him of his childhood, and he was dying in front of our eyes, and we just couldn't do anything. And every time we took him to the hospital because he wasn't feeling very well, nobody seemed to care.
I feel guilty. Maybe I should have, you know, done more for him. We put our trust in the hospitals, the doctors, which maybe I should have asked more questions.
I blame the pharmaceutical companies, I blame the civil servants, and I blame the government, because they covered it all up for profit.
Establishing who was responsible for the greatest treatment scandal in the history of the NHS is a central question for the inquiry. It is a huge undertaking, the largest public inquiry ever conducted in the UK, with around 150 staff combing through records dating back 40 years and more than 1,000 witness statements. These are just some of almost 2.5 million pages of NHS records that will be examined by the inquiry, and there are more than 5 million more documents from other agencies yet to come, all part of the process of establishing what doctors, officials and ministers knew about contaminated blood and when they knew it. Survivors, victims and their families have long suspected a cover-up, and they want the inquiry to ask questions right at the very top.
There's absolutely no doubt that former Prime Ministers have to be questioned as to why this happened. And the initial views taken by the Thatcher administration were carried on by her successor, John Major. And John Major is still alive and kicking, and certainly the victims are very, very keen to see him called to give evidence and answer the questions which they feel they have wanted to ask him for the last 40 years.
But there's a nice variety there.
Simon Hamilton is chairman of Haemophilia Northern Ireland. He was infected with hepatitis C and has cirrhosis of the liver.
Emotionally and physically on me directly, it has had a number of impacts. I'm currently going through counselling support. It's like the top of a jar being knocked off now that the public inquiry's there, and all these emotions which I thought I didn't have, or I thought I had controlled, those have come out. Every 6 months I'm tested to see if there's a tumour or the start of a tumour, which means liver cancer, and then the consequences of that. So for me, those are the realities. The reality for my family, my son, my wife, they bear the worry, and they also watch, and they live with that too. So it's shared with my mother and my brothers. My twin brother ended up with liver cancer and required a transplant, and I was with him through all of that. That is something I wouldn't wish on anyone. And there are many people who've gone through that, and for them, I shed tears. And for those who did not survive, I shed tears. I'm angry, yes. I feel betrayed by those who had a responsibility of due diligence to look after people like me and those others who are not here any longer.
Like every other victim, he knows this may be the best and last chance for answers.
The brothers and sisters, if you like, in this process, I don't think we'll settle for another whitewash.
I'm determined to find the truth, and the truth will come out.
We've lost so many people. So yes, the promise and the bonds that were made, this is what this is about.
The people that actually did cover up what happened should be punished.
Hopefully this inquiry will give us some justice and some peace.